Okay, so I think we can open our webinar now. My name is Petra Bayer. I am chair of the Equality and Non-Discrimination Committee of the Parliamentary Assembly of the Council. Have a webinar this afternoon, which is on sexual and reproductive health and rights, which are human rights, and they often are under pressure, especially in times of social shiftings and global crisis, of course, is a typical case of such a dislocation. We can see that women's access to SRHR, and let me shortly interrupt myself, we will use this acronym very often in the next hour. SRHR is standing for Sexual and Reproductive Health and Rights. So women's access to SRHR services is limited. Some governments use the crisis to scale down provision of services and rights in the field of sexual and reproductive health. Some even try to remove them altogether. But a crisis is always also a chance for new approaches and solutions. And we will hear also about positive examples today. The goal of the webinar is to raise awareness where hard-won rights might be at risk. We would like to share strategies and we would like to learn from good practice examples how to enlarge SRHR services and ensure these fundamental human rights for everybody. Let me mention how we will proceed in this webinar. First, all the panelists have time about 5 minutes for their presentations, and I really would like to ask you to stick to these 5 minutes. After the last presentation, all of the panelists are invited briefly to comment on each other, and finally we will end up with a round of questions and answers, which we are collecting with the chat function, which is on the right side of the screen of this platform, and where MPs and invited participants can raise questions. We will try to bundle them and then address them to the experts who can answer them. We are also live streaming this event on Facebook in addition, and I'm sorry, but we will not have a chance to also follow any discussions going on the Facebook side. Only on Blue Jeans. And I also would like to ask all except the panelists to switch off your microphones and cameras so we have a better transmitting function. And I would like to ask those who are speaking, those of the experts who are speaking, to switch on your microphone as well. So I now would like to come to our panelists, and I would like to welcome all of you. I'm very pleased that you are here with us this afternoon. I want to welcome Neil Datta, Caroline Hickson, and Orla O'Connor. I will always say some words to you when you are when it's up to you to speak. And I would like to start with Dunja Mijatovic. She is Council of Europe Commissioner for Human Rights. Earlier this month, Dunja issued a statement on COVID-19 with the title, Ensure Women's Access to Sexual and Reproductive Health and Rights, where she is calling member states to ensure. I would like to ask you, what are the main challenges from your point of view? What is most important to be done now? Dunja, please.
Thank you, Petra. I'm really very glad to have this opportunity to join discussion in this very important webinar on even more important topic, not just now during pandemic, but also before. I would like to greet all fellow panelists, but also all of you present in cyberspace. I have addressed several human rights concerns since the beginning of the COVID-19 crisis, including human rights in prisons, but data protection and media freedom. To me, it was also important to make recommendations to the states regarding this topic we are discussing today, and to make recommendations to the states. I'm therefore extremely grateful for these opportunities to address women's sexual and reproductive health and rights, a topic which is very high on my agenda since the beginning of my mandate, but also I think it's important to mention it was on the agenda of my predecessors, particularly Niels Mužnieks, who also dedicated enormous amount of time and energy in order to raise the awareness of the importance of this topic for the well-being of the societies, so not just for women. As I recently stated, many member states are taking laudable measures in attempt to mitigate the negative effects of the COVID-19 pandemic on women's rights and gender equality. However, in doing so, they should not neglect women's sexual and reproductive health and rights. And unfortunately, this is happening in too many member states. As it was shown in an issue paper that was published by my office in 2017, and I just mentioned my predecessor, full respect of women's sexual and reproductive health and rights is an essential component of Council of Europe member states' obligations to guarantee women's human rights and advance gender equality. So we are not talking about something that is not existing or something new. It is there, but maybe many governments seem to forget about these obligations when they enter the arena of adopting new laws that are suppressing rights. Given that the title of the webinar refers to challenges and opportunities, I can first tell you that challenges are numerous and huge. On one hand, some of the measures adopted to contain the spread of the coronavirus are undermining women's sexual and reproductive health and rights. Access to essential health information, services, and goods for women and girls is made much more complicated in times of lockdown and travel restrictions. And this is particularly problematic, I would say, for such services that are time sensitive, such as access to contraception, including emergency contraception and access to abortion care. This affects particularly women and girls who live in a few European states like Malta, where abortion is illegal or severely restricted, and who cannot travel abroad to seek assistance and care. On the other hand, I would say that many measures were already needed before the pandemic, but acquire an even greater importance now that the COVID-19 pandemic is deepening gender inequalities. This is something that I've been mentioning since the beginning of pandemic, and it's related to, I think, all human rights that are affected during these unprecedented times in Europe and beyond. It is actually showing us that, mistakes made before are hurting us now even more than ever before. Not much has been done previously, particularly when it comes to the rights of most vulnerable and marginalized groups. So the problems we are facing now are really an urgent call, or I can even say an alarm to member states, to the governments that really are putting human rights in the focus and are also thinking with wisdom, courage in the future and what is important for the well-being of our societies. What I think is important to do is the fact that we need to remove all pre-existing obstacles that exist in some places, such as mandatory waiting period and counseling for abortion care, unnecessary hospitalization, widespread refusals of care on grounds of conscience, and limited use of medical abortion pills. These may become unsolvable in these times of crisis, but I was also, I must say, struck by reports of difficulties in accessing quality maternal health care in the COVID-19 context. In some places, there were less staff working in maternity wards due to reassignment or other reasons. And I have also learned of cases of medically unjustified separation of mothers and newborn babies and refusal of a birth companion's presence. Another challenge is the fact that there have been very negative trends trying to weaken women's, but also LGBTI persons' rights. In Poland, as you know, the lower house of the parliament recently failed to reject a bill that would further restrict access to abortion, keeping it instead for further examination. And I noted a number of worrying attempts by ultra-conservative groups to use the pandemic as an opportunity to call for the rolling back of women's sexual and reproductive health and rights. As I stated recently, it is also disgraceful, I would dare to say, that COVID-19 should become yet another outlet for hate speech. And I'm concerned about statements associating LGBTI people with the outbreak of disease. Now, just a few words on opportunities. I was glad to see that some states have taken encouraging initiatives, facilitating access to abortion care and contraception during the lockdown. They have shown their true commitment to protect women's rights and autonomy, even in these difficult times, and I welcome such positive measures and urge all member states of the Council of Europe to follow suit. An opportunity would be to see this crisis, I would say, as a magnifying glass on the persisting violence against women, gender inequalities, and barriers in women's access to sexual and reproductive health care. And surely the main opportunity would be that measures taken to remove existing barriers should be sustained after the crisis. And this would help building a long-lasting, transformative equality that will benefit women and society as a whole. To conclude, my main recommendations for Council of Europe member states in the context of pandemic are the following. So they should ensure full access to sexual and reproductive health care information, services and goods for all women without discrimination, and with specific attention for women at risk or victims of gender-based violence and other vulnerable groups of women. They should consider access to abortion care, contraception, including emergency contraception and maternal health care, as essential healthcare services to be maintained during the crisis, and take, of course, all necessary accompanying measures. They should fully support women's rights defenders, which is an extremely important topic. Service providers such as healthcare staff, shelters for women victims of violence, family planning organizations and humanitarian assistance workers. During my visits to many Council of Europe member states, even before pandemic, I saw with my own eyes how grim and very complicated and dangerous the situation is when it comes to shelters, number of staff taking care of those women, and all these other issues that are related to this. Finally, they should address misinformation that we are facing now, but as I said, this is not a new issue. Gender stigma and societal prejudice affecting women's and LGBTI people's rights in the context of pandemic. Here I would stop, and of course I'm very much looking forward to hear other speakers and to engage in a discussion.
Thank you very much, Dunja. Just to pick out one sentence of your rich input, but I think it's really core to remind member states that they already have an obligation now to protect women, to guarantee SR, HR, and gender equality. I think that it shouldn't be forgotten even in times of crisis. I would like to move to Monica Ferro now. Monica is director of the Geneva office of the United Nations Population Funds. And already in March 2020, UNFPA issued a technical brief with the title COVID-19, a Gender Lens, where you take assumptions on violence, on child marriage and other gender-related issues under a lockdown scenario. So Monica, could you share the main findings with us, please?
Sorry, I couldn't unmute. Thank you so much, Petra. Let me start just by thanking you, the host, for conveying such an important discussion on COVID and sexual reproductive health and rights, and just to share with you how delighted I am to be here joining you all. And I think that you wouldn't mind if I send a special compliment to the Commissioner. I also read your statement on the 7th of May, and it really makes it very clear what you just said, Commissioner. We are talking about human rights. We are not talking about possibilities. We are not talking about options. We are talking about obligations that states have committed throughout many years. And I think it's very relevant to start the conversation by saying we are talking about human rights. And then, of course, a big hug to two of my great friends, Petra and Neil. I've worked for so many years with you in my previous life that it's really nice to be joining you in this panel. And it's interesting that you started, Petra, precisely by talking about our publication on the gender lens. We were one of the first agencies to call the attention to this, and it's quite easy to explain. We are a UN agency. We are the UN Sexual and Reproductive Health Agency, UNFPA, and as UN agency, of course, we are working under the chapeau of a system-wide approach, and because, needless to say, we are all in this together, and because we will only be as strong as the weakest of us. So, and by saying this, I would like to take the opportunity to express how thankful we are for all the health workers, the first responders, and all the people who are providing social services for women and girls. We are hearing every day that this pandemic doesn't discriminate, but we also know that women and girls and people in vulnerable situations, they are suffering a disproportionate impact. Women make up to 70% of our health workers worldwide, and they provide most of the care for children and other persons. And also all over the world, we know women are continuing to get pregnant and have babies. They are facing fear, anxiety, and they are also facing the disruption of health services. So it makes it really hard for them even to have a checkup, go to a clinic or a hospital to have a safe delivery, because most of the attention now is focused on COVID-19. So in countries around the world, what we are doing now is we are working with governments and we are working with communities to maintain life-saving services to protect the health and rights of women and girls. And we do that by championing the right to sexual and reproductive health and rights, so that every woman has access to contraception, they can enjoy a safe pregnancy and childbirth, and they can also leave fear of gender-based violence and harmful practices such as female genital mutilation or child marriage. With COVID-19, what we also saw was that there is an increased demand on domestic violence helplines and emergency shelters and across the world. As the United Nations Secretary General Guterres said, many women under lockdown for COVID-19, they are facing violence where they should feel the safest, and that means at home. So we know that disease outbreaks, and the Commissioner has mentioned this, they affect women and men in different ways. And we also know that pandemics, they make existing inequalities for women and girls and discrimination of other population groups, they make it worse. And this is why we have been insisting in adopting a gender lens. But I have to say that it has to be a gender lens, but that also reveals the intersectionality and other overlapping discriminations faced by adolescents, older women, women with disabilities, indigenous people, women of African descent, just to name a few, and for which we have provided technical guidance. And these are the ones we know they have truly been left behind, both in policy, both in programmatic efforts. We are calling the attention of governments and communities to the need to safeguard their sexual and reproductive health and rights at all costs. As the Commissioner was saying, for service to continue, for supplies to be delivered, for protection and support to the most vulnerable. And for this, of course, we need data. And let me just say this, given UNFPA's expertise and engagement with the census process, we can support countries and we can support communities in the developing of what we call quick population mapping based on our recent census data. We need to know how many they are, where they are, and in the situation they are in. And I've mentioned also that women account for 70% of the health and social sector workforce globally. And I would add that this already makes them particularly vulnerable. And having said this, I would be dismissive if I didn't mention midwives, not only because we are in the first international year of the nurse and the midwife, but because also midwives do much more than deliver babies, which is per se a pretty fantastic thing to do. But they educate, they empower women to lead healthy lives, to exercise their right to sexual and reproductive health, and they need to be treated as frontline responders. They need to be given the critical PPEs, the personal protective equipments, and they shouldn't be deviated to serve as emergency personnel, as we've been watching in many countries, as resources are reallocated to the pandemic response. And I would like to end by referring to the projections that UNFPA released in the end of April, 27th of April, I believe. And they truly predict a calamitous impact on women's health as COVID pandemic continues. What the research has shown is the enormous scale of the impact COVID-19 is having on women. As health systems, they become overloaded, facilities close, or they only provide a limited set of services to women and girls, especially when the resources are reprioritized and reallocated, or when many women and girls, they choose to skip important medical consultations because they fear of contracting the virus. And also relevant to the discussion that we are having is the disruptions in the global supply chain. They may also lead to significant shortages of contraceptive. As most of you know, I believe UNFPA has a supplies program. It's one of our thematic funds. And it's the only UN program that's dedicated to family planning, and it's also the world's largest provider of donated contraceptives. So we are very clear in saying that the provision of modern, short and long-acting contraceptive information, counseling and services, including emergency contraception, is life-saving and should be available and accessible during the COVID-19 pandemic response. What our research also reveals is that gender-based violence is expected to soar as women are trapped at home for prolonged periods. So women's reproductive health and rights, they must be safeguarded at all costs. The service must continue, the supplies must be delivered, and the vulnerable people must be protected and supported. And just let me put forward 3 numbers so that we can really see the impact of what this pandemic is having on sexual reproductive health and rights of women and girls. What our projections say is that 47 million women in about 114 low and middle income countries, they may not have access to modern contraceptives. And this 47 million is to add to the previous number that we already have, where we say that we actually know that about 230 million of women who want to use modern contraceptives, they don't have access to that. So a shortage of contraceptives could lead to 7 million unwanted pregnancies, an increase in unsafe abortions and complicated associations, and also in the case of condoms, a rise in sexually transmitted infections. On top of this, we also forecast an additional number of 31 million cases of gender-based violence that are expected to occur if the lockdown continues for at least 6 months. We also know that the numbers of domestic violence, the reported numbers of domestic violence, they are already far less than the actual number of cases. So can you imagine now women being locked down in their houses, not being able to get out and access services? So we know that the invisibility of the number is going to be even higher. And it's also relevant to say that during the response to COVID-19 and how it's affecting our societies, we also foresee that the disruption of our programs to end female genital mutilation could add 2 million new cases of genital mutilation, cases over the next decade, but cases that could have been averted. And I'm saying this for female genital mutilation, but for child marriage, what we are seeing also is that, again, the disruption of the programs can potentially result in additional 13 million child marriages taking place in the next decade that could otherwise also be averted. And I'm going to end with a call. When the Secretary General issued its plan on human rights and COVID response and recovery, that he called it, "We are all in this together," one of the recommendations is very clear. It's to mitigate the impact of the crisis on women and girls, including on their access to sexual and reproductive health and rights, and protection from domestic violence and other forms of gender-based violence, and ensure their full and equal representation in all decision-making on short-term mitigation and long-term recovery. So I do hope we are truly all together on this. But I'm going to end by going back to the beginning. These are all human rights. All that I've said today, all the rights that I've enumerated, they've been recognized in international commitments, in language, in many international forums. And those of you who actually know me know that I like to quote a Portuguese author when he used to say, in the beginning of the 19th century, he used to say, you know, when I was born, all the books that would once save humanity, they had already been written. All that was left was to save humanity. And I think that we are again in this juncture. We know what needs to be done to secure the dignity, human rights, and the development of women and girls. What we need now is just to get it done. Thank you so much.
Thank you, Monica. Also to echo one sentence you said when it came to the overlapping discriminations, it's really now an obligation and a commitment to leave no one behind, not just because of the SDGs, but also because of human rights and saving lives. We are quite behind our schedule, so I really would ask the following speakers to please stick to your time frame. The next one I'm happy to is that he's with us is Furat Benchika. He's a Belgian senator and PACE General Rapporteur on the rights of lesbian, gay, bisexual, transsexual and intersex people. Furat, we were celebrating Idehot last week, the International Day Against Homophobia, Transphobia, Biphobia and Interphobia. Is times of COVID times to celebrate for LGBTIQ people?
I think it's always time to celebrate diversity, but it is particularly a time there are many challenges, and I want to present you a few of them, and hopefully we can start a discussion about that. I would like to address first the barriers of the LGBTI community in general when it comes to access to sexual and reproductive health rights, additional barriers they face in the context of the pandemic, of course, and maybe some recommendation. So, as you know, our health systems are generally organized in a binary way, where man has access to some kind of healthcare and women to others. Sometimes you see the same binary logic happening in the field of insurance coverage. But just to give you an example, trans men might be given a male gender marker through legal gender recognition procedures, but still have a uterus of ovaries and therefore still needs access to sexual and reproductive health care, including pregnancy care, as well appropriated cancer screening. Just to give another brief example, a person with female gender marker may receive automatic alert for breast cancer screenings when they reach a certain age, but a person with a non-binary marker may not, even though they have need for this kind of services. So this kind of example just emphasizes the importance of our health care system and are adapted to the diversity of people's body. Second point, lesbian, bisexual and intersex women, trans men and non-binary people who are assigned female at birth, just like everyone, are going to need access to sexual and reproductive health care over the entire course of their lives. This includes access to contraception, gynecological care, prevention to HIV and other sexual transmitted diseases. However, and that's a reality for a lot of LGBTI women, they are still facing a lot of discrimination and access to healthcare. Just to give you another example, last week a new survey of the European Fundamental Rights Agency reported that over 52% of respondents assessed their general health as very bad. In other words, those LGBT people who are in most need of healthcare, including in the field of sexual and reproductive health, are not always getting the care that they really need. Maybe just to dive in a little bit more in the context of the pandemic. First of all, there's an overall picture in which healthcare and other emergency treatment of the COVID-19 has been considered as non-priority. In this context, access to hormone and gender-affirming treatment, which are really crucial for many trans and intersex people, and access to HIV-related care have become much more difficult. Secondly, many LGBT people are already faced discrimination on the labor market in some countries, and what we see as well, sex work is often the only field of work open for trans people. Lockdowns have made it impossible for many such people to work, exposing them to higher risk of poverty. As a result, even where it's still available, many simply can no longer afford hormone or gender-affirming treatments that they really need. So, some recommendations, I have 3 of them. First of all forms of healthcare, but especially in the field of sexual and reproductive rights, needs to be provided based on body parts of the person actually has, and on what health service each person organs requires to remain healthy. There is no need to remove reference to women in the field of sexual and reproductive health care. Gender-based barriers to service are real for all women. That's what we really need. But in addition, we need a new language that ensures that everyone who has ovaries and uterus, everyone who has the capacity to become pregnant, has access to the same health care that they really need. Secondly, we still need to work much harder to reduce discriminatory attitudes to the LGBTI people in the field of in the healthcare field, as well in schools and employment. Discrimination in all of these fields has a big impact on LGBT people and their sexual and reproductive health and their access to their rights. That means better training for healthcare workers, professionals, stronger anti-bullying campaigns in school, and higher penalty for employees who discriminate based on sexual orientation, gender identity, and expression as sex characteristics. And lastly, we need a lot of more data, as already mentioned, on how the pandemic is affecting the LGBTI people, and particularly in their sexual and reproductive rights. But it's already clear that hormones and gender-affirming treatments and HIV-related care must not be considered as non-essential health care, and that extra measurements must be taken whatever they are needed to ensure the LGBTI people continue to have access to such care despite the pandemic. And maybe just last minute, as you may know, today in the Hungary Parliament, the Article 33 will probably have a majority. It just it's just a good example how marginalized groups across Europe are always targeted as first in time of crisis. I really urge you all to show your solidarity to the LGBTI people across Europe, and especially today to those in Hungary. Thank you, Petra.
Next to Neil Datta.
Hi, Petra. We lost you for a bit, but Neil and I are sharing the presentation, so I'm actually going to start. So I'll take it that's what you asked me to do, even though we couldn't quite hear. So thank you. I mean, it's obviously a hugely challenging time for SRHR, but there's also huge amounts of innovation and energy going on to try and find practical on-the-ground solutions. So that's what Neil and I want to talk about. So I'm going to talk about our fantastic civil society organizations in Europe, and Neil's then going to take over and talk a little bit about those governments who are stepping up to the plate to support SRHR. So, I mean, this is just like any emergency. Somebody already mentioned first responders, and those are always the local civil society organizations on the ground. Long before the 4x4s get there in the tsunami, the local organizations are there. And this is no different. Our local organizations know the context, they know the needs, they know how to react swiftly, and they can figure out the best way to adapt to care and protect people. So we need to be supporting that. So I have 4 points, and I think the first one is that those local organizations first clear concern has been for vulnerable groups who, as many people have mentioned, are the most at risk and the most likely to suffer. And we've seen organizations doing fast and rapid assessments of which services are most essential and for whom, and making sure that they're providing those services by hook or by crook. So for example, in North Macedonia, the IPPF member association is still providing clinic-based services for men who have sex with men, for Roma women and girls, and for sex workers. Services such as STI testing, contraception, sexual and gender-based violence, and other real essentials. Yes, including antenatal. I think Commissioner also mentioned maternal health care. They also obtained specific permission from the government to accompany survivors of domestic violence to state support services. I think the importance of organizations who are already embedded in the community is crucial because while they can't do outreach work, they have those connections in the communities, and it's the community leaders who will accompany those people who need to come and receive an in-clinic appointment. In Georgia, they haven't been able to maintain so much in-clinic, but they've put a lot of their counseling and support online, and again, it's their connections with the community who's making sure that those people who need it are informed about the availability and how to access and support it, etc. Secondly, I think the move to telemedicine has been fast and furious. We surveyed our members, about 30 of them, way back, end of March, beginning of April, and already 50% of them reported that they were providing or they had moved SRH programs onto innovative channels. The health services, also partnering with other actors, even the commercial sector, through online commercial practices. And in Albania, we've seen that they're actually doing doorstep deliveries of contraceptives, and that's led by young volunteers. So while we have a delivery driver on one side, we have somebody coming to deliver the contraceptives on the other side of the road, and they're young volunteers, which is fantastic. In Ireland, my own country, the first country to allow abortion via telemedicine, we've seen the Irish Family Planning Association produce a series of sensitive, informative videos to support women through this newly remotely provided services. And many organizations who are already providing support online have widened and broadened those services. Also, organizations are monitoring how people feel about this because it's new, and the news is so far so good. We've had a number of surveys by different organizations. Georgia, for example, confirmed that most of the respondents felt more confident and more safe using the online services that they have moved to. Thirdly, somebody mentioned young people already, and we know that this is one group being affected by lockdown very severely with potential long-term mental health repercussions. And across Europe and in other countries, schools have been closed. So SRHR organizations have been working on innovative online ways to ensure that young people are still receiving the support and the education that they need on sexuality and relationships. Most organizations, again, have increased use of the platforms they already have, but they're also expanding. They are in the Netherlands. They've developed specific support for teachers and also for parents, because as we know with sexuality education, parents are a key audience. I think one nice piece of information we got from Estonia was, in fact, our member there reported that since they moved their classes to Zoom, they're actually reaching more young people than they were before the pandemic. So this is crisis into opportunity. And finally, I think the role that civil society has been playing in calling for legislative change is absolutely crucial. I don't have time to go into the many advocacy initiatives that have taken place, but I think the fact that so many partnerships already exist nationally and also across borders, so that countries are learning from one another. One country does something, another country picks it up, and the civil society know the arguments to use and they have the evidence. I'll just go into one because I think it's incredibly important. Somebody mentioned Poland, and obviously the Polish government counted on a time where they knew that women couldn't get out into the streets to protest, to try and further their cynical agenda, but they didn't count on the innovativeness of the people. And those women couldn't go on the streets to protest, but they got in their cars, they got on social media, they did protests in the lines for the shops, and while, yes, the bill wasn't rejected, it was sent to committee, it was not sent to the Senate, which could have had disastrous consequences. So really innovation and human potential is the name of the game. So we need to be really proud of our civil society. They're being innovative, they're active, they're determined, and even under the most difficult circumstances, they are protecting the sexual and reproductive health and rights of women, girls, men, boys, people of all gender identities, and particularly the vulnerable at this time. So I'm going to hand over to Neil now.
Okay. Hello. Thanks, Caroline, for that. I'm very pleased to be here. Also, allow me just a few seconds to say hello to some dear old friends, to Monica, to Caroline, Orla, Petra, and of course, Furat also. We were on a call last week as well. I have the great opportunity today to discuss the positive examples that we see coming out from different governments, which is a nice change for me because usually I'm the guy that people bring out to discuss all the anti-gender and anti-choice stuff that takes place. So this is a new opportunity for me to talk about something else. So I have just I have 3 things to say, and then I'll end with 4 key messages. So first, in terms of positive things that are happening, as much as we heard from the Commissioner and Furat, difficult things that are, and also Caroline, difficult things that are happening in Poland and Hungary in relation to sexual reproductive health and rights or women's rights. For example, the rejection of the Istanbul Convention in Hungary last week or so. Thankfully, that seems to be a rarer event rather than positive examples by different governments. And so I'd like to take us through some of these positive examples and really get into the nitty-gritty of what some of them are, so that, as Caroline said, they can serve as examples for other countries. So first, in terms of sexual reproductive health and rights, we saw that when health services overall were being challenged, a certain number of governments were able to quickly remove certain procedural and administrative barriers which impeded access to SRHR. So just as an example, some of what we saw in different countries was removing the need to renew a prescription in order to access contraception, or being able to access a prescription via telemedicine, as Caroline mentioned. Ensuring that emergency contraception is available over the counter. And in some countries, the UK and France, extending the gestational delays by which the at-home abortion pill can be taken. Instead of X number of weeks, you extend it by 1 or 2 further weeks. And then also extending free access to contraception for certain key populations. And in this respect, I just want to point out a very good example, and that's the example of Belgium, which plans to make contraception freely available, all types of contraception to all women up until the age of 25. Now, this was sort of in the pipelines before COVID, but it takes a lot more relevance in the current situation. Next example I want to look at is what happens when physical interaction in overstretched medical settings is not possible. And there we go back to the point Caroline made about telemedicine. we see that the formal health sectors in many countries have shifted towards being able to provide telemedicine. So here again, it's a question of government will. It is possible in many cases to do so, and even in the case of abortion. So that we saw that in Belgium, France, Germany, Ireland, as has been mentioned, and parts of Spain, certain parts of the abortion experience can be shifted to telemedicine, specifically in those countries which require a mandatory consultation or counseling visit of the woman before accessing the procedure. And in some countries, you can even have the whole procedure for a medical abortion, that is the pill, done via telemedicine. So there's ways of working around the need for actual human interaction for this type of access to health. A third area I want to take a look at is one that was already mentioned in terms of gender-based violence. We saw that this has been well reported that there's a spike and increase in gender-based violence. A number of different countries have been good in trying to address this scourge, so that in a certain number of countries, those who support GBV victims have been designated as essential services, as much as other healthcare providers. In a number of different countries, they've set up safe and flexible emergency warning systems. For example, signals you can provide in a grocery shop or in a pharmacy. And there's also new alert systems that women can access via phone, email, or text, where they can reach directly to the relevant police authorities. Also, there's alternative shelters being organized. And in this period of uncertain funding, increasing funding going towards organizations that provide protection for victims of GBV. And then finally, there's been strengthened government-led campaigns about the phenomenon. So we have good responses in terms of access to sexual reproductive health, telemedicine, and even in the case of abortion, and also gender-based violence. And I just want to end with 4 key lessons here. One is that in countries where the idea of care comes first, they were able to quickly act and provide new specific provisions, even within the context of COVID restrictions, to guarantee access to sexual reproductive health and rights. So basically, the main lesson here is that where there is a will, there's a way. The COVID restrictions do not need to stop us from accessing SRHR. Second lesson, telemedicine. This is particularly essential for women who are not able to travel to their doctors to get a prescription or etc. And as it safeguards the health of both the women and the healthcare providers. And it also alleviates unnecessary burden on the healthcare providers from having to have this physical interaction. A third lesson, and one that those of us working in this field have known about for a long time, but now this situation really sheds a light on it, is all the unnecessary administrative, medical burdens and obstacles placed on women in accessing certain services. Most of all, abortion, for example, mandatory counseling, multiple consultations at a doctor's office, hospitalization before a woman can access abortion, even medical abortion. Many of these obstacles date back to another period. They date back to when abortion was first negotiated as a compromise within society, so that abortion was made legal but made difficult. Now we need to see whether these are justified in the 21st century, as they are medically irrelevant. And maybe this is a good opportunity to shift towards streamlining the administrative provisions so that they fit with 21st century medical requirements rather than 20th century patriarchal perceptions of women's health and rights. And then finally, on gender-based violence, we see all the effort being done in certain countries on addressing gender-based violence. If they can do this during pandemic times, during COVID restrictions, we should encourage them to maintain the momentum even after the lockdown so as to really be effective. So thank you for that. I hope I stayed within my 4 minutes and look forward to the panel. Thanks.
Great. Thank you very much. Thank you, Caroline, for lining out the crucial importance that civil society organizations play, that NGOs play in this time. And Neil, welcome in a new role, monitoring the bright side of policy. And also underlining that it's the political will that makes the world move forward. I think that's really important to see that it's possible in times like that. So now we come to our last but not least panelist, Orla O'Connor. She is director of the National Women's Council of Ireland. And she will also share some positive developments on abortion care in Ireland, where I have to say, wow, well, congratulations. During the last 2 years, you really made great success in this field. So Orla, tell us how you did it.
Well, thank you, Petra, and thanks for inviting me to the webinar. And I think sort of my piece follows pretty well on, I think, from Caroline and Neil in terms of talking from a perspective of a civil society organisation. The National Women's Council, we're the leading national women's membership organisation in Ireland, and I was also one of the co-directors of the Together for Yes campaign to end Ireland's constitutional ban on abortion. So what I was sort of planning on doing was to look at how Ireland has protected sexual and reproductive health and rights during the pandemic, but also to highlight some of the gaps that and you know, for a long time Ireland was very far behind our European neighbours in terms of providing for women's reproductive rights. It was only in 1979 that married couples were finally allowed contraception. So we had a long way to come. So it was very monumentous and a really significant moment for women's rights in Ireland. It's just 2 years ago this week that people voted to repeal the constitutional ban on abortion and to enable abortion on request in early pregnancy. And this was the result of a really long campaign over decades, led by women, including my organisation, to now being able to provide abortion services and being part of our public health system on request in early pregnancy and then for help thereafter. So in fact, you know, really in 2019, you were seeing a rollout of the abortion services. So when the pandemic hit, it was at a particular moment when the government had committed to rolling out a number of other pieces on sexual and reproductive health and rights, such as, for example, universal contraception. So I think one of the immediate impacts is that a lot of those sort of positive things that were going to be happening have been postponed. So I think one of the key things, and that's what I just want to maybe say, is that one of the key things in terms of the response to the pandemic is that it was immediately very clear that Ireland's healthcare system, which was very much a two-tier healthcare system, was just so not appropriate in terms of how we respond to a pandemic. So there has been a commitment that public and private patients are going to be treated equally. And that, I think, is one of those areas that really points to what we as a civil society organisation will be campaigning for it to maintain after this pandemic. So during the first weeks of the pandemic, the government did respond from, you know, much calls from civil society to protect access to certain areas of reproductive health care. But we're very conscious in the National Women's Council that, you know, once there's any disruption on service, it will disproportionately impact on marginalised groups, such as women living in poverty, women with disabilities, traveller Roma women, undocumented migrant women, and women who are survivors of domestic and sexual violence. But to give some examples of some of the changes that have happened and also the positive changes in terms of access to abortion. I think the first thing to say is that it did highlight the restrictions within our abortion law. So the requirement in Ireland for 2 face-to-face appointments separated by a mandatory 3-day waiting period was a particular issue. So mandating face-to-face appointment posed huge risks, both to women, but also to frontline workers. And then there was particular concerns for women, for example, with disabilities and those with pre-existing health conditions. So following an emergency debate in our Parliament, abortion care is now being provided by doctors by phone or video for women who cannot attend health clinics in person. So that is, I think, a really important step forward. Efforts have also been made to maintain access to contraception during lockdown. So emergency contraception without prescription is still available from our pharmacies. And pharmacists can also supply women with additional contraception if their prescription has lapsed. Unplanned pregnancy counselling services have also shifted to being provided remotely or through phone. And our health service has also issued a number of sort of information pieces to the public, and they've issued guidance on sexual health during the pandemic. And I think another key concern in the immediate days was also care for pregnant women. And while maternity hospitals issued strict no visiting policies, they did say that, for example, partners could be present for delivery. However, a number of our hospitals across Ireland started to limit that and prevent that. So now there is official guidance in place that women should be permitted and encouraged, and that's the wording that's used, to have a birth partner with them during labour. And that's being a really important piece. But it is also becoming very clear from some of the qualitative data that's there that the pandemic is a huge source of anxiety for many pregnant women. And one study just published by one of our largest maternity hospitals has found very high levels of anxiety amongst pregnant women. So I think so those things maybe have been on the positive side, but on the downside, and I think that this is really problematic, is that other very critical sexual and reproductive health services have been reduced or paused entirely. So reproductive cancer screening or cervical and breast screening has been paused since the end of March, which is a particular worry for women who are outside standard screening intervals due to abnormalities, and women where mammograms following cancer treatment. So, this is an area that we want to give high priority to return to as soon as it is safe to do so. Infertility care is also not presently available. Infertility clinics have been closed since the pandemic hit. Women have seen their IVF and other schedules cancelled, and there's no clarity on when these services will resume. There are also significant restrictions to public STI services, including some closures and restrictions to HIV and STI testing. And of particular concern for us as well in the National Women's Council is that in the north of Ireland, just before sort of COVID really had hit, regulations were introduced to enable abortion care on request up to 12 weeks. And this was a significant step forward for women in the north who prior had to travel to England or Wales to access services. So when the pandemic hit, there has been an absence really of an adequate state response. So it's very much been up to women's healthcare providers and campaigners who've been working to ensure that women can access abortion care during the crisis. So I think as well that one of the key things, which is, I think very similar in all countries, but that, we clearly have an understanding that a person's sexual and reproductive health is very much determined and interconnected with their life circumstances. And I think that that's really critical in terms of how we look at the impact of COVID, but also in terms of how we move out of it. So things, the fact that women are absolutely in the front line in terms of our caring and health services. We're seeing in Ireland, as we're seeing globally, an increase in domestic violence, also the increase of caring responsibilities for women due to lockdown, and all of those things having a severe impact in terms of their overall health as well as their sexual and reproductive health. So just maybe a final point in terms of, looking at the future in terms of the Irish case study, so that, very much so, there's been very positive efforts in terms of protecting sexual and reproductive health in Ireland. And there's also been significant support, I think, for women who are at the front line. I think one of the key things will be that issue of our public health service and the need to provide universal public health services that are not on ability to pay. So it's really important that they're maintained after the crisis. And I think as well, in terms of learning the lessons, and I'm conscious of this from listening as well to the other speakers, but that it's really brought home to us how important it is that the government take proactive steps to publicly fund reproductive health care and put a deliberate focus on preventative measures and primary health care for marginalised women. And I think there is certainly a concern among civil society that as we move out of COVID and into perhaps a recession, that may not be the case. So thank you.
Thank you very much, Orla. I monitored the chat quite closely, and so far I haven't seen any questions or comments. So we really have time now that you, amongst each other, respond to those who you would like to do and address the others if you would like to. So, and I will start in the same order as before. Dunja, would you like to make any remark to somebody?
Thank you, Petra. It was extremely interesting, but also full of information, and also confirming to me that paying attention to this subject, not only now during this unprecedented time, but in general, is of extreme importance. And I can only assure you that together with my team, I will continue to listen to you, to be your voice as much as I can, in order to defend those rights that are so important for all of us. I would like to, really support and to agree with everything that you were saying. You are just, in a way, we are echoing each other, which I think is important, but at the same time it shows that from different sides, being NGO or working with the governments or international organizations, we are having the same views on these important topics. I think it's, I would like to particularly mention the importance of what Burak Benchika said about LGBTI rights persons. I think it's important just to mention to you that just a few days ago I joined the call of the UN experts and other experts, and it is available on my website, and it is really related to the LGBTI persons, and maybe I can just read briefly the extract from the statement. The relocation of health resources has also created or exacerbated shortage of anti-retrovirals for those living with HIV, while also impacting the ability of trans men and women to receive hormonal therapy or gender-affirming care. Gender-based curfew laws and policies have reportedly condemned gender-diverse persons to permanent seclusion, while making trans individuals targets for humiliation and violence when going out. So I think, it is fair that I mention this at the end, because I did not dedicate too much time in my introduction, but nevertheless, I think it's important that this is also an issue that I pay particular attention to, and I will continue working with all of you and many other courageous people and organizations and NGOs dealing with this topic. As you know, me and my team are very approachable, and it will remain so, and we are looking forward to work in this time of pandemic, but also afterwards. Thank you for inviting me. Stay safe and do your extremely important work with the same vigilance as you are doing it now.
Thank you so much. I'd like to get now back to Monica. Would you like to address somebody?
Thank you, Petra. I'm going to be very short, because it's what the Commissioner just said. We were echoing each other's commitment, but through multiple perspectives, and I think that it's really important. And I want to stress something that I said, but that most of us have also touched upon. It's the whole issue of intersectionality, as you've raised. We keep on addressing this sexual reproductive health and rights like if it was either a very group-oriented service or a one-size-fits-all. And I think that this, we really need to understand that we are talking about human rights, we are talking about commitments that were already done, and so it's not an option, it's an obligation for most of the member states of the United Nations, just to put it bluntly. And I think that what we need is what Neil was saying. It's to shift from a certain bureaucratic perspective to a more innovative perspective. And I think there was a lot of food for thought here in this debate. And I would just like to share with you that the UN is also learning by doing, and that this is truly a good way to learn from you and also to share with you what we are doing. We are raising our voice. We are not lowering our arms. But as you know, times are not easy from a financial perspective, but also from a political perspective. And so we are here to keep the fight on.
Thank you very much, Monica. We will keep fighting for sure. Furat, also a fighter. Would you like to say some concluding remarks?
Yes, thank you, Petra. Thank you, everyone, for your presentation. Maybe just one point that triggered me a lot is what you said and Neil said about leadership and political will. This is a momentum. There will never be a momentum like this. There will be post-corona. So it just learned us that we really need political leaders who wants to fight for sustainable change towards all vulnerable groups. But what we see today is those leaders that we have today in many different European countries are using this pandemic as a way to erase the rights of, for example, the trans and intersex community in Hungary. What we see as well is how the rights of women are under pressure, and I hope that it helps this kind of pandemic, this kind of crisis, help us to realize the sense of urgency to have leaders who have the courage to really move forward and strengthen human rights. Thank you.
Thank you, Furat. Human rights is also a good keyword for Neil and Caroline, who would like to start to address the others.
I can. Yes, I think human rights is a good word always, but I also think we need to be conveying the same sense of the actual real effects on people's lives, because I think what I liked about the panel is that there was a sense of urgency there with all of us, and there was so much real reference to what's happening in people's lives, and the urgency that Furat said. You can't put this kind of thing on hold, because if somebody's going to have FGM committed, that will change a woman's life forever. If somebody can't get their ARV for HIV, that's going to affect that person's life forever. If somebody is killed or significantly hurt by their partner where they can't escape, that person's life is going to be changed forever. So I think we need to be talking with a moral urgency that's based in the real life experience, so that we can get across what that means in people's lives, in women's lives, in girls' lives, but also in men and boys and people of all gender identities. So urgency.
Neil? We can't hear you, Neil. Neil, you have to unmute. Yeah.
Okay. Yes, can you hear me now? Yep. Okay, sorry about that. Yeah. Okay. I just want to say a few things that came to mind as I was hearing the other panelists. So first, I just wanted to congratulate the Commissioner on coming out with such a powerful statement. It came just at the right time and has the right tone for what countries should be, for what governments and countries should be doing. And which brings me to my next point. I hope that what we're seeing in terms of how countries are behaving or not doing, that this can feed into the work of the Parliamentary Assembly in terms of how it is that the Assembly monitors the obligations of member states. As has been pointed out, these are human rights. These are not new things. The Assembly has a responsibility of monitoring these obligations of member states, and I hope that it feeds into the work of that's taking place. I believe that there's a committee on monitoring obligations of member states. There's also a role for your committee as well. Another point that I wanted to draw upon is what Monica Ferro from UNFPA mentioned. And Monica mentioned a number of different statistics, but there's one of them which I picked up, which is, I believe, like 47 million new women would have an unmet need in family planning. Just think of that number. this is going to wipe out years, if not decades, of progress and development around the world. And so as much as what's happening here in terms of human rights constraints in Europe is a challenge we have to deal with, a certain number of millions of unintended collateral damage in the developing country will take place, and I think it's something that we need to take into account as well. Monica works for the UN Population Fund now, so has an obligation to be diplomatic. But I think we need to see how catastrophic the unintended consequences of that would be. So thank you.
Thank you, Neil and Orla. What would you like to have as your last word?
Yeah, I mean, three things, I think. First of all, yeah, I would really agree that I think, Commissioner, your statement is so supportive of the work that civil society organisations are doing, because it really strengthens us and creates more momentum as well. I think the second thing, though, is that we are experiencing a complete reversal in terms of the pace of change in some areas. So the pace of change on women's rights is always so slow, and yet we've experienced here some quite progressive, innovative solutions to things. And I know that for so many civil society organisations across countries where that's happened, a big part of what we'll do will be how do we hold on to that, and how do we ensure we hold on to that? And I think we need to do that collaboratively across all sectors. And the third thing, I think, is that concern, though, that as we move into a different period, and particularly, I think, perhaps a more of a downturn in terms of economies across Europe, that sexual and reproductive rights aren't then pushed back under the guise of recessions or austerity measures. So I think that is going to be a key piece in terms of how we can work together to make sure that doesn't happen. Thank you.
Indeed, very key. Thank you very much. I will try the impossible and try to summarize the last 70 minutes, the key learnings of the last 70 minutes. So that is to use the pandemic as a kind of magnifying glass to look at pre-existing obstacles on existing disparities and really try our findings, use them to help people to really have access to their fundamental rights. It also means that we really should stick to evidence, that we should look on research, what enormous impact this pandemic has on the lives of women, and also use this evidence to make evidence-based policy in the future. We must not forget about the diversity of people's bodies and their individual priorities, which also have to be addressed in a pandemic where, of course, you also set as national health policy some national priorities, but individual priorities are important nevertheless. And also want to line out that solidarity with countries like Hungary, Poland, Turkey, and people fighting there for their rights is really key and important for all of us. I also would take away that all that what was developed now in the field of telemedicine, of new partnerships, of distant sexuality education, of legislative change, of obstacles, of administrative obstacles who suddenly could be thrown away, that we really should keep this momentum and that we really should build up on that, what we have gained now in this situation, and also learn that it's always important to be prepared. I think one of the lessons Neil shared with us, that those health systems who are prepared also are acting much quicker. It's an important takeaway, I think. And I think we also should learn that we always need a long breath that we can turn the tide. But in the end, we can turn the tide. And use all these developments now, keep the momentum, and really take it as an opportunity for the time after the pandemic, not forgetting women living with disabilities, have special health conditions, and all this. I think that's really very important. I want to thank all of you for your really valuable contributions. It was really a great pleasure to have you here the last hour or so. I also want to thank Giorgio, who acted in the background and shared all the links to the mentioned papers in the chat. May I ask Giorgio also to share that, because we didn't manage that now at the moment, of course, to share it on the Facebook site, that there it will be available for a longer time, so everybody can have access to these important papers, this important resource, this important information. Thank you very much to all of you. Thank you very much to the Secretariat of the Equality Committee. And I hope you keep fighting all the time from now on, but I'm sure, I know all of you, I'm sure you keep fighting. And thank you very much for your contribution to make this Europe and this world a better place for everybody to live in. Thank you very much, and have a good afternoon and good evening. Bye.
Bye. Thank you.
Bye. See you.
Hi, everyone.
Bye.
Bye.